Hello everyone, how's it going? Have you ever experienced a urinary tract infection? Maybe you have in the past, or you're experiencing one right now. Well, they're actually very common. They're also called UTIs for short, but healthcare providers they treat about nearly 10 million of these infections each year. Today we're going to talk about some of the symptoms, those who are at risk, how it's treated, and actually what we can do to prevent them. I know you're probably thinking of cranberry juice or supplements. Well, we're going to talk about that a little bit later in the video. If that sounds interesting to you, then keep watching. So what is a urinary tract infection? It's actually an infection in any part of the urinary system, which includes the kidneys, ureters, bladder, and urethra. Now the urethra is the tube that carries the urine from the bladder to the outside of the body. Now, urinary tract infections typically occur when bacteria enters the urinary tract through the urethra and it begins to make its way up into the bladder. E. coli causes more than 90% of bladder infections, and it typically exists in the large intestines. So let's talk about some of the symptoms. You can actually have a urinary tract infection and be experiencing no symptoms at all. Or you may be experiencing some of these: a strong urge to urinate that doesn't go away, burning, like a burning feeling when you're urinating often and in just small amounts, urine that looks cloudy, or it may look like it has signs of blood in the urine, if it's appearing red, bright pink, or cola colored. The urine could have a strong smell to it. Women can actually have pelvic pain with this. Particularly in older adults, ages 65 to 70, they may experience confusion, and if the older adult has dementia, they actually this could increase their dementia symptoms. So let's talk about those who are at risk. Well, those with the female anatomy have a shorter urethra, so there's less distance for that bacteria to actually reach the bladder, so they'd be more at risk. Those who've reached menopause might have more issues because after menopause, there's a decline in estrogen, which can actually cause changes in the urinary tract. Also, the bladder contracts less strongly, so it may be harder to empty the bladder completely. People who have blockages due to kidney stones or an enlarged prostate could be more at risk. Those who have a suppressed immune system, such as diabetics. One reason being that diabetes can actually cause nerve damage that may make it hard to empty the bladder completely. Those who have to use catheters or who've had a recent urinary procedure may also be more at risk for a urinary tract infection. So now let's talk about treatment and prevention. But before I move on to that, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also open up the description box below so you can actually tap on the links and read more information on this topic if you'd like. So when it comes to treatment, if it's a minor urinary tract infection, sometimes it can get better on its own, but most require antibiotics. So your healthcare provider will take a urine sample to actually confirm if you do have an infection and actually do a urine culture to establish what bacteria are present. That way they can find out which antibiotic would be the most effective. So if it's a simple infection, it usually clears up within a few days, but you want to make sure you continue to complete taking the whole prescription. Now, some people get frequent infections, or recurrent urinary tract infections, and that's if they have 2 or more in a 6-month period or 3 or more in a year. It's considered recurrent. If that's the case, your healthcare provider may want to do some imaging, ultrasound, CT scan, MRI with contrast dye. They may even want to possibly scope to look inside the bladder. It's called a cystoscopy. They also may recommend a low-dose antibiotic for 6 months or more to prevent these. Sometimes they'll recommend vaginal estrogen therapy for those who've reached menopause if they continue to have these infections. If you have a severe infection, you actually have to do IV antibiotics in a hospital. We don't want to let it get that bad. Definitely not. But most infections are in the lower tract. That's the most common type to have. If it gets into the upper tract, it actually could be a lot more severe. So your doctor may actually want to do blood work to see if it's spread into the bloodstream. Now let's talk about prevention. Not surprisingly, we definitely want to make sure we're drinking plenty of fluids, especially water, to help flush that bacteria out. Now we can also try cranberry juice or cranberry supplements. Many people have had success with this, even though it has not been proven to prevent a urinary tract infection. Some research has found it to be effective, but the studies have shown mixed results. You just want to remember, if you try cranberries, it's not to treat a urinary tract infection, but to maybe prevent a future one. And this is because cranberries actually contain antioxidants with antibacterial and anti-inflammatory properties. So they actually may help prevent the bacteria from even attaching to the cells in the walls of the urinary tract. Some people even try probiotic supplements or yogurt or other foods with probiotics. But you always want to speak with your doctor about if it'd be safe for you to take supplements. For instance, if you're diabetic and you want to try cranberries, you'd have to try the low sugar or no sugar options. We can also try to make sure we urinate when we feel the need instead of holding it. Wouldn't be a good idea to hold it for more than 3 to 4 hours. We could change out of workout clothes or bathing suits pretty quickly instead of remaining in them for some time. We can opt to try to shower instead of bathing. We also want to try to avoid potentially irritating feminine products like deodorant sprays, douches, powders. It's recommended for women to wipe front to back after going to the bathroom, emptying the bladder after sexual activity, and can even avoid spermicidal products because they actually can lead to bacterial growth. So if a urinary tract infection is treated promptly, it's rare to have complications, but if it's left untreated, it can lead to repeated infections. It can lead to permanent kidney damage. If you're pregnant, it actually could lead to you delivering a baby that has a low birth weight or premature. It can even affect the pregnant woman's blood pressure, because when you're pregnant, it's more likely to spread to the kidneys. So you really want to get that checked out if you have any symptoms like that. It can cause a narrowed urethra in men. It can even cause sepsis. In fact, 25% of sepsis cases originate from the urogenital tract. And that's a potentially life-threatening complication of an infection. And that can especially happen if the infection goes up into the kidneys. So while urinary tract infections are very common, it's still important to seek treatment because serious medical complications could happen if you don't have the right treatment. So you definitely want to speak with a healthcare professional. If you're having any symptoms, make sure that you are going to get the proper diagnosis and treatment. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.